Alright, I'm Cheryl Ma, and my project was on nose and mouth injuries. So, nose and mouth injuries obviously are injuries that are found in the nose and in the mouth. And it'll be pretty easy to recognize. Typically, there's bleeding. For nose, the most common kind of way to recognize is if there's a bloody nose, and then for mouth, like if there's a tongue, a lip, or a tooth injury, it's pretty easy to recognize. So when we're talking about nose and mouth injuries, there's two types, and those are minor injuries and severe injuries. Minor injuries are typically ones that are on your skin or just directly above the bone, such as cuts and abrasions, bruises, bloody noses, and knocked out teeth. Typically, these injuries will heal up pretty quickly. However, it's also possible in a nose and mouth injury that you have some severe injuries, such as a fracture of one or more of the facial bones. Because both the nose and the mouth are pretty close, they're on the face, and so if you hit it, there's also a possibility of hitting the bones underneath it. And then what many people don't know is that you can also have a head, a neck, or a spinal injury if you have pain in the nose and the mouth. Like if someone gets hurt very badly in the nose and the mouth, it can also cause a concussion. So in terms of getting nose injuries, the most common kind of nose injury is just a nosebleed because the cartilage on the nose is so delicate, and so a lot of times you'll get a bloody nose. And one way to get it is to fall, or if you get hit on the nose, you can break the cartilage, or if you just breathe really dry air, it's another way to get a nosebleed. Changes in altitude, especially dramatic ones, and then also certain medical conditions, like if you have hypertension or high blood pressure, there's also a bigger chance that you'll get a nosebleed. And then the use of certain medications, like if you use a blood thinner for your blood, it can also make you more susceptible to nosebleeds. So the most common way to stop a nosebleed is just to pinch your nostrils together while sitting forward, or if someone else has it, tell them to do that. Because if you do lean straight up or backwards, there's also a high likelihood that the blood can go inside of your body, while you want all of the leftover blood to get out of your system. And so you want to do that. You want to keep the nostrils pinched shut for at least 5 minutes. And then once you do that, you can check to see if you're still bleeding or not. And if you are still bleeding, try it again, maybe a couple more times. Just hold your nose and lean slightly forward for 5 minutes and then check afterwards. However, if the bleeding is really, really bad, like if you're gushing blood, then obviously you should call 911 or the designated emergency number. And I think in all of the United States, the designated emergency number is 911. So yeah, if it's a really bad nosebleed, then make sure to call 911. Now, in terms of mouth injuries, there's many different types of mouth injuries. There's ones to the lips, ones to the tongue, ones to the teeth. However, the first thing that you want to do if you see that someone is injured in the mouth is make sure that they can still breathe. Because if there is too much blood or there's loose teeth and it's blocking the airway, then that person might not be able to breathe. So you always want to make sure that the person's leaning forward first, just to get anything that is blocking their airways out of them. And then afterwards, you want to have any blood. If there's any blood or saliva, you want to lean them forward or lean yourself forward to make sure that it all drains from the mouth. Or if it's really bad, you want to place the person on his or her side in the recovery position, so that way any liquids, they'll always go to the side of their body, which allows them to always have airways and to always breathe. And then since the best way to stop bleeding anywhere is just to hold a gauze pad over it and just to apply as much pressure as possible. You obviously want to do this in the case of a mouth injury. If they're bleeding on the outside, then if it's someone else bleeding on the outside and you have the gauze pad, then you should hold it over the site of the bleeding and apply as much pressure as possible. However, if the person is able to do it themselves, then the best case scenario, like especially if the bleeding is coming from inside of the mouth, is to have that person apply direct pressure onto the wound, because it's easier and safer if they do it themselves, because there's always the possibility that they'll like bite you or bite your fingers if you're holding the gauze pad or applying direct pressure onto the inside of their mouth. In terms of lip and tongue injuries specifically, obviously, as I said before, you just want to apply as much pressure to it, because lip and tongue injuries are always ones on the outside of the skin. So when you do see them, the most important thing is to hold a gauze pad there. So one of the things that you can do is place a rolled gauze pad between the lip and the gum. And if you roll it up, like, gauze is always a really sanitary way to apply pressure. And then another gauze pad you want to place on the outer surface of the lip, and just place it there to collect the blood. And then if it is bleeding, then of course you want to brush it against to apply pressure. If the tongue's bleeding, you also want to use a gauze pad and then apply direct pressure. Basically just like push against the place of the bleeding, because it's the best way to stop the bleeding. And then after that, you want to apply a cold pack wrapped in a dry towel on the lips or the tongue. So wherever it is, maybe put something cold over it. Dental injuries. For dental injuries, the first thing obviously that you want to do is locate the tooth, because there's a really high likelihood that if you are able to locate the tooth, that you can bring it to a dentist. And if you do it in enough time, then like the dentist can put it back on your tooth, or sorry, put it back in your mouth, and hopefully like that tooth can grow back and survive. And also you want to make sure that the tooth isn't blocking the airways. And then after that, you place a rolled up gauze pad into the space where the tooth might have fallen out, and then you want that person to bite on it so that there's a little bit of pressure. I mean, there's a pretty obvious pattern here. It's like you always want to take a gauze pad, put it wherever it's bleeding, and apply pressure, because that's the best way to stop bleeding. And bleeding is the most common thing for nose and mouth injuries. After that, like I said, try to locate and save the tooth. So you want to find it, and then once you do find it, in terms of where to put it, the best place to put it is this thing called Hank's Balanced Salt Solution. It's a solution that has the same consistency, and it basically mimics the environment of a mouth, so that way there's no tooth decay, and that way like also there's no like dirt or anything that gets in or on the tooth, which is obviously not very good. However, if it's an emergency, or like, I personally don't have this salt solution, so I would use something more more accessible, such as an 8 white, coconut water, whole milk, or even the injured person's saliva. And it's important to note that when you're picking up the tooth and you're like placing it and everything, only to pick it up by the crown, because if you touch it too much and in too many places, it's possible that it can hurt the tooth. And then afterwards, you want to seek dental emergency care as soon as possible, because the sooner that you do it, the sooner that there is like a likelihood that that the tooth will survive. And typically this only takes about 30 minutes to put in the tooth, but once you do, hopefully that will help the patient. Yeah. And that's all for tooth and nose injuries.